Good morning everyone. This is Kailin Kamikawa. Regarding the outbreak of corona in South Korea, the outbreak of infection is spreading. On December 1, 2021, the number of new infections with the new coronavirus in South Korea reached a record high. The number of newly infected people based on midnight on December 1 was 5,075 in Japan and 48 inflows overseas, for a total of 5,123 people. It was announced that the number of seriously ill people was 723, the highest number ever. It is no exaggeration to say that the collapse of medical care has begun. Moreover, the outbreak of Omicron strains is also suspected in South Korea. Even so, why did K-quarantine collapse so easily? No wonder. Also, Korea's proud corona diagnostic kit is completely useless in detecting Omicron strains. You are not at the stage of attaching Aya to the Japanese diagnostic kit. Did the rest of the diagnostic kits end up in a pile of garbage? I thought, but it doesn't seem to be the case. Taking advantage of the fact that only Korean kits do not react to Omicron strains, for example, with a Japanese diagnostic kit, first use it for diagnosis to detect corona positive. After that, if you test the sample with a Korean kit and see if it shows a positive result, if it is positive, it is an Omicron strain, and if it is positive, it is a Lambda strain other than the Omicron strain. It is a usage that can be provisionally diagnosed. It may be effective as a method of reusing the only Korean diagnostic kit that does not respond to Omicron strains. I see, I'm glad it wasn't wasted. That's all.
And we start with COVID-19. South Korea sees another spike in COVID-19 infections, with the daily caseload driving above 5,000, a record high. South Korea also reported suspected cases of the new COVID-19 variant Omicron. Kim Hyun-sung has our top story.
The daily COVID-19 caseload in South Korea has surpassed 5,000 for the first time. The country on Wednesday reported an all-time high of 5,123 new cases. This is a steep hike from the latest peak, which stood at around 4,100 last Wednesday. Critical cases also hit new highs, with 723 critically ill patients reported. An expert said that if South Korea keeps current measures in place, there could be 10,000 cases a day by the end of January. Health authorities in response to the latest surge have said that they'll look into imposing extra measures.
The government will discuss extra prevention measures on the size of private gatherings in the capital area, limiting unvaccinated guests in cafes and expanding vaccine passes, and will announce our conclusion sometime this week.
Meanwhile, South Korea has found its first suspected cases of Omicron. Health authorities said Tuesday that a couple that had visited Nigeria tested positive for COVID-19, and officials are checking if they have the Omicron strain. Both Canada and Hong Kong have also seen Omicron infections in travelers from Nigeria. Health authorities confirmed the couple transmitted the virus to their teenage child and one of their acquaintances. So currently there are 4 people in South Korea suspected of carrying the Omicron strain. The test results that tell if they have the Omicron strain are expected on Wednesday night sometime around 9 p.m. Concerns are mounting following news of a confirmed Omicron case passing through South Korea. A Namibian diplomat who was confirmed as being infected with Omicron in Japan had a stopover at Incheon International Airport. Health authorities are scrambling to investigate whether the virus has been transmitted locally. Kim Hyun-sung, Arirang News.